Zombie apocalypse.
Hello viewers, welcome to my channel Medicine Era. Myself Mayuk, and today we are going to talk about NSAIDs, non-steroidal anti-inflammatory drugs, and its pharmacology. So what are NSAIDs? NSAIDs are also called as non-steroidal anti-inflammatory drugs. So this is the full form. So what are their uses and what are their applications in medical science? Mainly, in this name, this particular two words, non-steroidal, is a very good inner meaning. Okay, non-steroidal means in this structure, steroid ring is not present. Steroid ring means so this ring is not present in this structure. So they are called as non-steroidal. According to the steroidal rings, they are classified into two parts, mainly number one, steroidal, and number two is non-steroidal. So they are containing the steroidal rings and they are not containing the steroidal rings. This is the basic difference. Okay, so we don't have to discuss about that. We have to discuss about this portion, non-steroidal. Okay, so in case of this type of drugs, the main functions of them are number one, inhibit pain sensation. Number two, inhibits pyrexia or fever. Number three, inhibits inflammation or swelling. Okay, so these type of drugs are mainly used to inhibit the pain sensation, inhibit the pyrexia or fever, inhibits the inflammation or swelling. So this is a very important part of medical science or important part of pharmacology, these non-steroidal anti-inflammatory drugs. Okay, we have to discuss this type of segments in later phase with our ongoing video. Okay, so in case of mechanism of that particular NSAIDs, we have to discuss it about some enzymes which are mainly responsible for the generation of this type of functions, mainly pain, swelling, and inflammation also, and as well as pyrexia or fever. Okay, so in case of any type of injury which has happened in our body, suppose a particular injury has happened in the hand of yourself. Okay, so the main part which is affected is the cell membrane of that particular portion of tissue. So the impact or the injury is happened in the cell membrane of that particular tissue or cell. So in case of that injury or impact, the cell membrane mainly consists of phospholipids. So the direct impact is happened in the phospholipids. So from there, that total reactions are happened or going to be happened. So we have to discuss it with a diagram. So the mechanism. So in case of any impact or injury, that directly affects the phospholipids of what? Phospholipids of cell membrane. Okay, so these phospholipids are then converted into arachidonic acid. Okay, so this conversion of phospholipids into arachidonic acid is catalyzed by a particular enzyme that is called as phospholipase A2. Phospholipase A2. Okay, sorry. So after the conversion of phospholipids into arachidonic acid by the enzyme phospholipase A2, this arachidonic acid is converted into different type of molecules which are mainly responsible for this type of functions, pain, inflammation, etc., etc. So this arachidonic acid is converted into what? Thromboxane or prostaglandins. Okay, thromboxanes are denoted as TXA2 and prostaglandins are also called as PGE2, PGI2. There are different type of deviations or differentiation in this segment of prostaglandins. They are mainly PGE2, PGA2, PGI2, PGG2. This type of examples or divisions of prostaglandins are there. So mainly here the conversion is PGE2 and PGI2 from the arachidonic acid. This particular conversion is catalyzed by a particular class of enzymes. They are mainly called as cyclooxygenase or lipoxygenase. Two different enzymes there, cyclooxygenase and lipoxygenase. Cyclooxygenase are mainly divided into two parts, that is COX-1 or COX-2. Okay, so these particular two enzymes are mainly responsible for the conversion of thromboxane and prostaglandins. Okay, so you have to keep it in your mind that in case of COX-1, it converts the arachidonic acid into thromboxane A2 or PGE2 or PGI2. But in case of COX-2, that converts the particular arachidonic acid into only prostaglandins. There is no conversion of, or there is not any type of conversion of thromboxane. Okay, so this is the main difference, COX-1 and COX-2. Okay, and we have to know that these prostaglandins and thromboxanes have the different type of functions. Number one, TXA2 means thromboxanes. They have the main function in platelet aggregation. Number two, prostaglandins. They have the main functions in the mucus formation, pain sensation, as well as to increase the renal blood flow. Okay, so thromboxane have the function for platelet aggregation, prostaglandins have the functions for mucus formation, pain sensation, and to increase the renal blood flow. Okay, so in case of these two type of molecules, the main functions are that. But if we talk about the mechanism of NSAIDs, they are mainly used to inhibit the particular enzymes that are cyclooxygenase. Okay, so they are mainly inhibiting the cyclooxygenase, means COX-1 and COX-2, inhibited by NSAIDs. This is the main mechanism. So for the inhibition of that particular COX-1 and COX-2, these functions are not happened in the human body due to these enzymes are inhibited. So these type of molecules are not synthesized, because these type of molecules are synthesized from the COX-1 and COX-2 from arachidonic acid by the use of these two enzymes. If these two enzymes are inhibited, then these functions are not happened due to the lack of thromboxane and prostaglandins. So by this way, the NSAIDs are inhibiting the pain sensation. So you have to keep it in your mind that they are also inhibiting the mucus formation, as well as they are increasing this renal blood flow will be decreased, and also platelet aggregation is not happened. So if we consider these type of functions rather than pain sensation inhibition, then there will be in some cases adverse effects, in some cases good effects. Okay, so you have to keep it in your mind also the other effects of NSAIDs. So now we are going to start the classification of NSAIDs. So they are mainly classified into three parts. Number one, selective COX-1 inhibitors. Number two, non-selective COX inhibitors. And number three, selective COX-2 inhibitors. Mainly, according to the names, selective COX-1 inhibitors means these type of drugs are only inhibiting the COX-1 enzyme. Non-selective COX inhibitors means these type of drugs are inhibiting both the COX-1 and COX-2 enzymes. And selective COX-2 inhibitors means these type of drugs only inhibits the COX-2 enzymes. Okay. What are the examples? In case of selective COX-1 inhibitors, it is ketorolac, ketoprofen, ibuprofen, etc. In case of non-selective COX inhibitors, it mainly piroxicam, naproxen, etc. In case of selective COX-2 inhibitors, they are mainly etodolac, diclofenac, meloxicam, etc. As we know that these type of drugs are mainly inhibiting the cyclooxygenase enzymes. So cyclooxygenases are mainly responsible for different type of molecule generation, means thromboxane, prostaglandins, and they have also the different type of activities in human body. So we have to keep it in your mind that in case of therapy, we have to choose the particular drugs that are mainly responsible for or inhibition of this type of therapies, because if a patient is suffering from a very much peptic ulcer, okay, so we cannot give him this type of drugs in frequent amount, because this type of drugs are mainly inhibiting the mucus formation. So if the mucus formation is inhibited, so this patient will be suffering from peptic ulcer, okay, in a greater form, because the mucus is mainly responsible for protecting that particular ulcer, okay, from the gastric acid which is secreted after a meal or before a meal, okay. So we have to keep it in your mind. In case of therapy, we have to choose that drugs by seeing the particular patient's different type of other effects or other disorders which he or she might be suffering from, okay. So this is the main reason why these type of drugs are classified into these type of segments: selective COX-1 inhibitors, non-selective COX inhibitors, and selective COX-2 inhibitors, okay. So this is a very important topic. After that, they are also classified into two parts, mainly in case of analgesic. So we have to know about at first what is analgesic. So in case of that NSAIDs, they are mainly classified into, in case of therapy, according to therapy, they are also classified into three parts, mainly number one, analgesic, number two, antipyretic, and number three, that is anti-inflammatory, okay. In case of analgesics, these type of drugs are mainly reduces or inhibits the pain sensation, inhibits the pain sensation. In case of antipyretic, these type of drugs are mainly reducing the pyrexia or elevated body temperature of the human being. Means in case of presence of pyrogen in our blood, that will affects that will leads to the generation of pyrexia, means elevated body temperature. In normal words, it is also called as fever, okay. So these type of drugs, antipyretics, are mainly used to reduce the fever or pyrexia. Reduces pyrexia or fever. Anti-inflammatory, these type of drugs are reducing the swelling. So they are the main three differences, okay. In case of analgesic, they are also divided into two parts. First one is narcotic analgesic, the second one is non-narcotic analgesic, okay. So in case of analgesics, they are divided into two parts, mainly narcotic analgesics and non-narcotic analgesics. The example of narcotic analgesics are morphine, okay. And in case of narcotic analgesics, we have to use aspirin, paracetamol, and also diclofenac, etc. So what are the difference between narcotic and non-narcotic analgesics? Narcotic analgesics are mainly responsible for depression of our CNS, okay. So they are mainly depressing the CNS and then reduces the pain sensation, okay. But in case of non-narcotic analgesics, they are not usually responsible for the depression of CNS, but also they are used to inhibit the pain sensation. So this is the main difference between narcotic and non-narcotic analgesics. They are depressing the CNS and they are not depressing the CNS, but both are used to inhibit the pain sensation. In case of the soldiers who are in the battlefield or in the war front, after any type of injury during the battle, in the previous era, in the history, the morphine is usually used in case of reducing their pain sensation in case of soldiers in the battlefield. But nowadays, the use of morphine is very decreased, okay. Now we are used only the non-narcotic analgesics, which are not depressing the CNS, but also they can inhibit the pain sensation. So this is the main difference between narcotic and non-narcotic. And in case of morphine, one of its derivative is diacetyl morphine. Diacetyl morphine. Acetyl morphine. This is a common name. It is also called as heroin. Heroin. Okay. So this drug is mainly now in the abusing form. They are mainly abusing in different type of activities. So this is mainly denoted as an abuse drug, diacetyl morphine. So they are mainly inhibiting the CNS. So they are not using usually, okay, or their uses are now banned in India and as well as in the whole world, okay. So this is about analgesic, antipyretic, and inflammatory, okay. Now, as analgesic, we can talk a little bit about aspirin. Aspirin. Aspirin is chemically denoted as, or it is also called as acetyl salicylic acid. Acetyl salicylic acid. Okay, the structure is like that. Okay, so this is called as acetyl salicylic acid. In previous history, the salicylic acid is also used in case of pain management. But after the invention of aspirin by a great organization in Germany, okay, they are introducing aspirin at first in history. Okay, so acetyl salicylic acid is mainly used to inhibit the pain sensation. So this inhibition of pain sensation, the process of inhibition of pain sensation is called as analgesia. Analgesia. Okay, this is an important term. How aspirin is used to inhibit the pain sensation? They are mainly used to inhibit the pain sensation by inhibiting COX-2 enzyme. Okay, so inhibition of COX-2 enzyme leads to the degeneration or not generation of any type of prostaglandins. So the pain sensation will be relieved. So this is the way, this is the mechanism of action of aspirin. In case of aspirin, they are also used to inhibit COX-1. And inhibition of COX-1 leads to not generation of any type of thromboxane. So this type of thromboxane generation or not generation will lead to the no platelet aggregation. So there will be a certain chance of bleeding after the injection of aspirin. So this is the main topic, or main part. So if the aspirin, or as the aspirin is used to inhibit both the COX-1 and COX-2 enzymes, so it is also inhibiting the prostaglandins. So the pain sensation will be inhibited, as well as they are inhibiting the formation of thromboxane. So no platelet aggregation is happened. So there will be a chance of severe bleeding. Okay, and also this prostaglandin is mainly responsible for mucus secretion. So without any prostaglandin, mucus secretion is also inhibited. So in case of any type of patient who are suffering from peptic ulcer and ingested that aspirin, they will also have a chance to severe their peptic ulceration. Okay, because mucus is mainly used to protect that particular ulcer from that acid secretion or hydrochloric acid secretion. So without the mucus secretion, that ulcer will be getting O's and O's. Ulcer will be O's. So these are the side effects. So no platelet aggregation, ulcer will be O'd. Okay, but these particular fact we can use in different type of other disease management. In case of heart failure or stroke, or in case of any type of thrombosis, we can use aspirin because it is used to degenerate the aggregation of the platelets. So the blood will flow very easily. And in case of stroke or any type of cardiac patients or any type of patients who are suffering from thrombosis, this aspirin is used as a therapy or medication. So in case of management of thrombosis, aspirin is also used. Okay, and another use of aspirin is it will also increase the respiratory condition or respiratory capacity of a patient who is suffering from severe asthma, because aspirin creates CO2 generation in our body. So it creates carbon dioxide generation. So if the generation of carbon dioxide is increased in our body, then our respiratory center will be stimulated. And after the stimulation of that respiratory center, the respiratory capacity or the respiration capacity will also be increased. So in case of any patient who are suffering from asthma, aspirin is also used because it creates the CO2 generation in our body. So these are the main effects. You can use it as side effect, you can use it also as good effect of aspirin. Okay, so these are the total pharmacology of aspirin. Now we will discuss something about antipyretics, as for example, paracetamol. This paracetamol is used as both analgesic and antipyretic, means it is used to inhibit the pain sensation as well as it will be used in the inhibition of pyrexia or fever or elevated body temperature. Okay, so paracetamol is also called as N-acetyl para-aminophenol. In USP, means United States Pharmacopoeia, it is also called as acetaminophen. Acetaminophen. In USP, it is also called as acetaminophen. Okay. So in case of paracetamol, it is used to decrease the elevated body temperature. In case of pyrogen, accumulation in your blood, it will elevate body temperature elevation from the normal level, means increment from 98.4 degree Fahrenheit or 37.5 degree Celsius. So the temperature of the body will be increased from that normal level. That is also called as fever or pyrexia. Fever or pyrexia. Okay. Our temperature regulator of our body is hypothalamus, or it is called as the thermostat of our body, hypothalamus. So in case of pyrexia, the hypothalamus will be dysregulated, or the working capacity or the normal working capacity or of hypothalamus is not regulated. So that will lead to the elevated body temperature or pyrexia. So in case of paracetamol, paracetamol directly affecting on the hypothalamus, and it will promote vasodilation. So our vessels will be dilated, and due to the vasodilation, sweating will be happening. Due to the vasodilation, sweating will be happening, and this sweat will be evaporated from our body by getting the latent heat from our body. And the sweat will be evaporated from our body by getting the latent heat from our body. So by getting the latent heat, it will decrease the body temperature. So this is the mechanism of paracetamol by which it can decrease the body temperature from the elevated level. You can also observe that in case of administering paracetamol, we can feel some sweating after 1 year or after 1 hour or 1.5 hours. Okay, so this is the main process. Why the sweating has happened? It happened because the latent heat will be getting out from our body for the body temperature decrement. So this is the main mechanism of paracetamol by which it can decrease the elevated body temperature or decrease the pyrexia. So this is all about paracetamol. You have to keep in your mind that in case of NSAID therapy, there will be so much side effects. So you have to restrict the use of NSAIDs because they can directly affecting our GI system. They can cause the GI bleeding, also cause the worsen of our ulcer or generation of our ulcer. They can also cause a severe bleeding or hemorrhage in our body. So the use of this type of medications will be restricted, and also that will be suggested to take after a practical observation from a registered medical practitioner only. Okay. So without any observation or without any indication, you have not to take this type of medications. This is a mandatory conditions. Okay. In case of inflammation or any type of anti-inflammatory activity, we can also use indomethacin. Indomethacin. So they are mainly working by inhibiting different type of inflammatory molecules. By inhibiting different types of inflammatory molecules. So by inhibition of different type of inhibitory molecules, they are also inhibiting the swelling or inflammation. Okay. So this is all about NSAIDs, non-steroidal anti-inflammatory drugs. Their classifications, their mechanism of actions, their different segments, what are their side effects, and how can we use this type of medications, and what are the precautions to be taken for using this type of medications. So this is all about the pharmacology of NSAIDs or non-steroidal anti-inflammatory drugs. So I hope you have enjoyed all the topics for today, and please subscribe, share, comment, and also like my channel. And your comments will be delivering myself to make this type of videos more and more. And please give your comments and tell me in the comments that what type of subjects or what type of topics you have certain types of problems in pharmacy. Then I can make this type of topic in a video form and will serve for you. And thank you for watching this video, and please fill your subscriptions for me. And thanks a lot, and see you next time. Thank you.